Well, good evening, everyone. Thank you for tuning in. Janet Dermody here with Cape Breton Originals. We are here to shine the light on what's going on with mental health, addiction, and the opioid crisis going on across Canada. We are basically advocating for, change because I lost my brother, and I think that because of the mental health failing him, that he could still be here with us right now. He had an addiction problem and he died with an overdose. And I'll give it over to my co-host, Tina.
Hi, everyone. I'm Tina Olivero, most fondly known these days as Ben's mom. I lost my son, Ben, to overdose last summer, and it is the tragedy of my life for sure. To watch your loved one wither away right before your eyes, to have them stolen by drugs is the hardest thing a parent will ever have to go through. And having suffered that tragedy, going through this with Ben every step of the way, I really have understanding and lived experience of where all the breakdowns are in our system, not only here in Newfoundland, but across Canada, that is causing a drug crisis, epidemic, an overdose epidemic, which is actually leading to about 22 deaths per day in our country, which is just off the charts because the fallout of that is so sad. The parents, the families, the sisters, the brothers, the uncles, the aunts, the children, the devastation is just off the charts. So what we plan on doing is getting all this information, taking addiction out of the dark and bringing it into the light, making it a mainstream conversation so that people can actually talk about it and get things solved. This whole era that we're in, this drug era, illicit drug era, has so many loopholes where all roads lead to drug use. We want to turn that around and have all roads lead to recovery.
Exactly. So with that being said, we're going to bring up a video that the federal government made in cabinet, and this is their conversation of how they're going to try and make changes or talk about the things that are in place now. So we're going to have stopping and talking points. We're going to be watching the comments, and please join in the conversation and let us know what you think.
Committee on Health. Today's meeting is taking place in a hybrid format pursuant to the standing orders. I understand begin that study today. Before we begin, I'd like to introduce the officials that we have with us from the Canadian Institutes of Health Research, Dr. Samuel Weiss, Scientist Robinson, Director General, Marketed Health Products Directorate. From the Department of Indigenous Services, Jennifer Novak, Director General, Mental Wellness.
So just introducing themselves at this point, try and skip through their intros.
Willingness to come before the committee on this study probably in the new year. And with that, I'm going to turn the floor over to Jennifer Sachs from the Department of Health for her 5-minute opening statement. Sachs.
Thank you very much. Bonjour, bon matin. Good day, good morning. Thank you for providing my colleagues and I with the opportunity to address this crucial issue. In my comments today, I would like to share some information about what we know about the crisis based on the data we collect at the federal level, and I'd like to outline some of the measures we've been advancing to.
Now, not to cut it off too early, but I would wonder, Tina, is there any way we can get this data that she speaks of that they have at the federal level? Because in my mind, I'm feeling the data needs to be shared publicly so people can see what's really going on. What do you think?
Yeah, it is available. Yeah, it's available on the government website. So yeah, we can get those figures for sure.
Good. I would like to see those.
Reduce harms, prevent overdose and related deaths, and to expand access to treatment and support recovery and well-being. The overdose crisis we face today is a profound public health emergency reaching into the lives of individuals across diverse demographics. This public health crisis is having a tragic impact on people who use substances, their families, and communities across the country, and it's shaped by a wide variety of factors.
Yeah, can you just hold it there, Janet, for a second? So
Yep.
right off the bat, they're proclaiming that this is a public health crisis and emergency, not unlike COVID-19, with very similar numbers of deaths, actually. So it won't be long before we actually hit. I think there was 53,000 odd deaths in Canada from COVID-19. We're now upwards of 40,000 deaths from opioid deaths.
Oh,
So
God.
so now, like, what we have, when considering what we did with COVID-19 and the epidemic that we're currently living in right now, this illicit drug crisis and emergency is being acknowledged. The only difference is we don't have the same level of attention, resources, power, infrastructure focused
Mhm.
around solving this thing. And that's why parents and family members are so upset.
Exactly. You've nailed it. They're trying to make it seem like it's not that bad, and the programs and people they have handling it now are doing a good job. No, they're not. They're doing a horrible job, and we've got dead family members to prove it. So, you ready to continue on?
Yeah.
Okay.
38,514 opioid overdose deaths since January 2016.
38,417 opioid deaths since January. That's 2016. That is crazy.
While
It is.
90% of these deaths in Canada occurred in British Columbia, Alberta, and Ontario, it is important to note that elevated rates have also been observed in other areas with smaller population sizes, including Saskatchewan and Yukon. Most apparent opioid toxicity deaths are among young to middle-aged males. In fact, males accounted for the majority, that is 73%, of accidental apparent opioid toxicity deaths. Indigenous peoples are disproportionately impacted. For example, while First Nations make up 3% of British Columbia's total population, 16% of those who died of an overdose identified as First Nation. Also, according to data from the Alberta First Nations Information Governance Centre, the rate of opioid poisoning deaths is 7 times higher for First Nations people compared to non-First Nations people in the province. The data also confirm that very high rates of overdose deaths are the direct result of increasing street drug toxicity. Of all reported overdose deaths, 81% involve fentanyl. Multi-drug
So
toxicity is
stop there for a second. So worth noting as well. Like the very first question that comes up for me is, okay, well, why is 90% of the deaths happening in BC, Alberta, and Ontario? Like, what is the reason for that? We haven't been given a clear explanation as to why that is. And then why is it 7 times higher for our Indigenous people? Like, what is if we started to track back, and uncover that and unpack all of those variables, maybe we'd start to get some answers. But
Mhm.
this illicit drug crisis right now, which is affecting 73% of males, why is it occurring to 73% of males? Like, I have my own theories for that. My son was one of those 73% of the males. Your brother was one of those 70% of the males. And I, as the founder of Guardians of Recovery, I take calls from moms and parents every day, and the majority of them are males. So what's going on that we are wiping out an entire generation of our male youth? Really, what's
Yeah.
happening?
And why is it so many that are Indigenous? That is concern for me because because of drugs, am raising my granddaughter, and she's Indigenous, and her dad has a definite problem, and he's also battling this. So I have great concerns because I don't need to have to worry about my granddaughter losing somebody that she loves dearly. So that again touches close to home for me.
Yeah, or herself.
contributing factor to the
Yes.
crisis. Increasingly, people are using a mix of drugs, which is significantly increasing risk. Cette crise est généralisée.
This crisis is widespread and pervasive. Understanding why people turn to substances engages the full range of social determinants of health, as well as adverse childhood experiences, trauma, poverty, mental illness, and chronic pain.
So when they say that all those things, it all leads to being in a hospital first, and yet that's not the first approach that they're taking here. The very first approach that they should have is not even in the list of how they tackle the problem. So there's already a problem in addressing the problem. The solution is the problem.
Sure, we
Yeah.
are pursuing evidence-based strategies.
Go ahead.
Yeah, so in the case of Ben, over the 7 years that he struggled with this illness, I was not able to get him into a hospital. And in fact, it was quite the opposite. The privacy laws were designed specifically to protect people's privacy. But what they actually did was led to Ben's death because I didn't know if he was sick. I didn't know he overdosed. I didn't know if he was needing help. I was kept out of that equation under the privacy laws. And for Ben, I mean, he didn't want me knowing that he was sick or overdosing or that kind of thing. So in his mind, that was keeping me out of the equation was good for him. Yet it cost him his life. So when people are out of their minds and they're a danger to themselves and others, at some point, parents and family members have to be in the circle of care to watch out for our loved ones, to make sure that they don't die. Like for our privacy law to be the way it is, excuse me, what it means is people like Ben who are in shelters, for example, and surrounded by all kinds of workers, these workers are forced to keep their mouths shut because it's a privacy law, and actually are, facilitating or enabling the death of this person because they're held back by the privacy law. They can't communicate the extent of the danger they're in. And so think about it. I mean, all of this leads back to policy for the privacy law, which keeps people out of care and keeps people out of hospital.
Exactly.
So-
And I could say, as far as for my brother, he was constantly denied help when he went to the hospital here in Cape Breton, at the Cape Breton Regional Hospital. He would go in, they would assess him, and they just looked at him like he was just some druggie looking for drugs when he was looking for mental health. And he never got seen because there was always other people that were more important. Well, then my mother had convinced him to go to Ontario, which is where he ended up, his life ended, and he didn't get the help that he needed there either. So straight across Canada, people are being denied the help they need in our hospitals. So we'll carry on. You ready?
Yeah.
Is to comprehensively and compassionately address this crisis. It is within this context that the Government of Canada has been actively working for many years, mobilizing efforts across a continuum of interventions that span prevention, harm reduction, treatment, and enforcement, and work together to reduce harmful stigmatizing attitudes and behaviors. Substance use prevention initiatives are tailored to reach most people most at risk. For example, the Ease the Burden campaign is a targeted effort to reach men in the trades, a demographic disproportionately affected by the overdose crisis. This campaign, with over 26 million views, shows how we are raising awareness and reducing stigma in these populations. Recognizing how important timely access
Hold
to
on,
quality...
up on that point, Janet, for a second. So why are men in the trades at high risk? Like, we've got to start to recognize some of these patterns that are going on, these demographics, the
Well, I can
regions.
tell you,
Yeah.
I worked in the trades. I was a drywaller. I did mudding. So I literally was working at the Coast Guard College here in Cape Breton, and I was doing the fire taping, it's called. And all I heard from the men all day long is their bosses kept pushing them to do more. And
Yeah.
they were going through lots of pain in order to maintain their job and to keep doing the pace that the workforce demanded. These men, and I can tell you because I was a woman in a man's trade, these men and myself, my body felt like somebody took a steamroller and beat me with it. It was hard on the body. So I'm going to have to say, from just my own experience and from hearing the men that I worked with, it is hard on the body. So because they needed these
Yeah.
medications just to do their job is what I think.
Yeah, and a lot of that I've heard from people is that 12-hour shifts. In order to maintain a 12-hour shift, people are OxyContin was like super prevalent in these,
Mhm.
camps. And OxyContin was so highly addictive that before you know it, everybody in the camp or the majority of people in the camp are trying to stay awake, trying to
Yep.
meet a 12-hour shift, not to mention the fact that they're isolated and they don't
That.
have their family and loved ones around. And
Mhm.
what is there to do at camp that is actually interesting and stimulating other than work if your life is all work? So I believe that we're setting up the environment and the culture in our workforce for people to use
Depend
switch
on
off
them.
drugs. Yeah.
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 It's planned to fail is exactly what it is. And it's going to lead to the demise of these people, these men, much sooner than what they would have without their help. Are we ready to
Yeah.
continue?
Yes.
Okay.
Treatment services is. We have made significant investments to expand access, including specialized services for youth and much needed withdrawal management, commonly referred to as detox. The government has also made efforts to expand access to services which reduce harms and prevent overdose deaths. This includes the distribution of naloxone and widespread training. We have made it
Oh,
easier for
let's
communities.
hold it there, Janet. So detox, let's talk about detox. Detox and rehab is a joke in Newfoundland and Canada.
And here.
People can't get into these facilities. Like the most important part of all of this is recovery. So why is it that like I take 2 to 3 calls a day from parents and loved ones with addicted loved ones that are wanting help, asking for help, asking to get into recovery. Why should that person have to wait? So when I started doing my research and asking, calling up the detox center and asking why people can't get in. Well, we only have 3 beds and therefore, we normally have 19, but we don't have the staff for it. So then you start thinking, okay, well, why don't they have the staff? Well, we can't find workers. Well, why can't you find workers? Well, we don't have those sort of resources or we can't attract it. So what we're talking about is a lack of hiring creativity and more than anything, a lack of leadership and creativity to make sure that no matter what, there's people to staff those beds. Like it's not a priority. It's not that they don't have the budget. It's not that they don't have the people. It's that they don't have it as a priority. When the most important place, the absolute most important place where we should be focusing our attention before anything else, whether it's harm reduction or whatever, before anything is making sure when people ask to go into care that they get in care that day, not weeks and weeks later. And once they get out of detox, they can go straight into rehab without, relapsing and failing again and hurting themselves more with the gaps in between detox and rehab. It is unbelievable. It doesn't make any sense whatsoever. Basic common sense will tell you, put your resources, put your energy, put your focus and your priority on giving people who want to get help immediately. That's the best thing we could possibly do.
100%. You've nailed it on that front. I agree. And over here, it's the exact same way. Too few beds. And even if you are lucky enough to get a bed, it's like 5 days. What is 5 days doing? Nothing. That is a blink in the timeline that it takes to get somebody from using to wanting to never use again. You're looking at 6 months for a complete program, and that would still be a bit short for some people. So
When
there's a huge
coming
gap.
back from opioids, you need a year or 2 years.
Yeah. Well, that's what I'm saying. And this 5-day program, what a slap in the face to anybody who asks for help because it's doing nothing, absolute nothing.
Yeah. What do you guys think out there? Do you have family members that had to wait to get into detox? Are people having to wait to get into rehab? What do you think?
Yeah. Let us know what you think, guys. Don't be nervous or shy to speak up, because that is the problem. What's going on with this issue is a lot of people don't want to talk about it because there's so much negative, toxicity online when you speak against, say, harm reduction or against safe injection sites, or you're advocating for rehab and detox. So don't be stigmatized by that, because in here it's a welcoming environment where we want you to share what you feel about it and what you think is gone right or what you think has gone wrong. Okay, in the meantime, keep your comments in, put them in the comments so we can address them, and we'll get back to the video.
Communities to establish supervised consumption sites. There are currently 39 sites across the country, which have seen over 4.3 million visits, responded to nearly 50,000 overdoses. For many, these sites are the only direct experience people will have with health providers. As a result, there have been over 257,000 referrals to health and social services.
257,000 referrals to health and mental services. And yet we still haven't got that as the first avenue for people to go to. That's alarming. Honestly, it's alarming.
And not only that, just hang on a second, Janet. Like, people are in one of three places. They either have a mental illness, or they have an addiction, or they have both. And all three of them require different protocol of care. So not only do we not have people diagnosed up front when they are they present with an issue or problem, but we're just sending people out. Like, with, for example, they could have the same type of thing as someone with dementia. They could have anosognosia, where they have no cause and effect. They can't tell if they're, sick or not. They have no ability to actually self-reflect, and therefore they can't make life-saving decisions. And we're putting them out on the street with this brain condition, with this brain illness, not unlike someone with dementia. So think about it. We're saying these people have choice. The majority of them don't have choice. They have a brain illness that doesn't give them the capacity to have cause and effect. And we're just leaving them out there in the elements, in the cold, and in tents, and asking them to fit, like it's inhumane.
Is. So Stacy brings up a really good point here on the screen. So she's saying that the problem is that it is a helping field and no one gets paid enough. It's a demanding job for multiple levels. And it's true. It'd be exhausting on somebody who's trying to help, help somebody who is in a frantic state of mind when they first get to them. And to get people involved needs to be a steady stream without being stuck. She said people call in sick a lot. People aren't doing the job. And management expects that people work to the point of burnout with limits to little to no vacation. And instead of refreshing, they quit the field altogether. That is a huge impact on giving people help. It is.
It is, for sure. And you are dealing with very challenging situations, much like the trades. And what do they go to? Drugs.
Yeah, exactly. So, I mean, we don't need to have our health professionals falling into the same trap as, everybody else is getting stuck in order to get by and get through their day. They're resorting to drugs. So we need so many different solutions. And that's why it's a multifaceted problem that needs a multifaceted approach. Are we ready to get back to the video?
Yeah.
Okay.
Simultaneously, our law enforcement and border officials are actively countering illegal drug production, diversion, trafficking, and related crimes. As part of the response to this crisis, the government also continues to support research that is helping us to better understand substance use in Canada and to allow for the development of evidence-based policies and programs.
Okay, hold on to that. Just stop there. So evidence-based policies and programs. See, as far as I'm concerned, this is all a policy issue when it comes down to it. Because, for example, in Canada, trafficking illegal drugs is illegal, right? Illicit drugs are illegal. Yet in BC, people can go around with 2.5 grams of illegally acquired drugs. Like, how did they get them? They either got them in the mail, they bought them from a dealer, whatever. No matter what, that person still had to be trafficking in order to trafficking, and they had to buy trafficked drugs. Yet, here's the policy: you're not allowed to sell drugs, but you are allowed to have a certain amount of drugs on you. You can right now in BC have 2.5 grams of fentanyl on your person with no consequence, even though you bought illegal drugs. And what does it take? How many people will that drug actually kill? Fentanyl, that 2.5 grams of fentanyl can kill 10,000 people. So if you have one person who actually has 2.5 grams of fentanyl, pure fentanyl on them, it could have the potential to kill 10,000 people. And people say, oh, well, that's not true because it's mixed with stuff. Okay, what about 5,000 people per person? This is the ludicrous policies that we're making. It's not, just doesn't make sense whatsoever. It's not legal to sell this stuff, but you can use it. So where did you get it? Did it drop out of the sky? Like, it doesn't make sense. It's basic
No.
common sense.
It doesn't. And a lot of times that these safe supply drugs that they're giving out, you'll literally see it's a cycle going on. So they'll get issued their safe drugs. They take their safe drugs and go sell those on the street to the young people that are 10 to 18-year-olds that are dying. Okay. And then they'll use the money that they're poisoning our young people with and go and buy their drugs of choice. So this program has got such a dangerous spin-off to it that it's leading to an exponential amount of deaths that they can't even fathom what's going on in the background with their safe supply.
Exactly. And what's safe about giving someone more of the thing that's killing them? Let's look at the logic. Check out the logic. Okay. We know the more alcohol you drink on a daily basis, the more brain damage you will have. We also know that doing the more illicit drugs you do every day on a daily basis, the more brain damage. So giving people more drugs is causing more brain damage, which is then taking away the capacity for them to make safer decisions for themselves. A plus B equals C. So I don't understand how people can justify giving people more of what's killing them. Like, our society is not set up where all roads lead to recovery. It's where all roads lead to drug use. And that's the problem. Who's behind that? Why is that happening? What kind of culture, what kind of corruption do we have to have in our policy where you can have drugs on you, but it's illegal to actually sell them? You can, make sure that nobody takes care of you because of the privacy law so that you continue to use drugs. Like, it just, none of it makes sense to me. And it's leading to our kids' deaths.
It is. And because of what they're doing is why we're in this mess of the crisis right now. And they're going to say this in this video, it's an opioid experiment. It really is the opioid experiment. And what it's doing, it's almost like the COVID experiment. It's just obliterating anybody who goes into, whether you get a prescription from your doctor, whether you're trying it for the first time, or whether you're at one of these safe injection places or harm reduction places. It's literally ending your life, and your days are marked. You just don't know it.
Yeah. Well, in the case of Ben, when Ben died, his autopsy report said that what he had in his system was fluorfentanyl, cocaine, MDMA, Ritalin, Zopicon, bromazolam, and naloxone. And that doesn't even include the only two things that I knew he had in his system, which was weed and Suboxone. So what's going on in this whole system? Like, Ben was taking Suboxone and doing all these other drugs as well. And not only that, they're all taking half of it, selling them, doing other drugs with them. You can take cocaine with Suboxone, but you just can't take other opioids with Suboxone. So the whole system is all roads lead to Suboxone.
Yeah.
So I'm not saying that there's not a place for Suboxone. I think there is a place for Suboxone if, for example,
and a time length. They have this never-ending time length. Why?
But in our family, we have bipolar, and the minute Ben smoked weed, it unlocked bipolar in Ben, and he had no cause and effect right from the get-go, right out the gate. Eventually, after he was on opioids, they gave him Suboxone. How do we know what the effects of Suboxone are on someone who has bipolar like Ben? We don't know. We know that it
No.
rots your teeth out, right? Maybe it rots your brain out, but we don't actually have the long-term data and evidence to prove that that is a sensible solution. And why I don't think it is because within 2 months of Ben taking Suboxone as a solution, he was dead. And I believe it was direct result of Suboxone mixed with all these other drugs. His brain was just shattered. He didn't know he was taking everything and everything in front of him at that point, and none of it made sense. And that happened with the onset of Suboxone.
Exactly.
And
So
and
Stacey,
he actually tried to get into a rehab, and they said, "No, go next door and get on Suboxone to an outpatient clinic," which is criminal.
it is criminal, and it's happening at more hospitals across Canada than we can think of. People think that when you go to the hospital, when you need help, that's the be all to end all. No, they're sending people away because they don't have the staff, they don't have the capacity to deal with the crisis that's being put on them. They just don't have it, and it's because the government has made so many cuts and has made so many of these programs. They're sending the money to the wrong places that are giving drugs that are helping people to stay on the road of drugs, are destroying every community across Canada. And these places and programs, they have to be shut down and stopped. They have to, or else where are we going to be in 10 years? Where?
Exactly. And Stacy is right on too. She said,
Mhm.
while methadone clinics are better than meth or heroin, but it's like no end game. When do people get off it? Is this a band-aid? Or if you take it, you have to go to classes or counseling or recovery or something to further yourself to get off. Like this open-ended, free for all. You just keep taking it forever as long as you want, without any sort of infrastructure to get support and recovery, means you're
Exactly.
stuck with taking another form of synthetic opioid
Mhm.
for the rest of your life. You are now a slave, literally a slave. Like
Yep.
this is modern day slavery. You are now a slave to that methadone. You have to have it. You can't, it's wrapped around your whole life. You can't even go on vacation without methadone.
Oh, this one will hit home to you a lot, Tina. Read that comment from it's Nancy up in Halifax.
Also giving a 16-year-old child the choice to leave their home where parents are trying to set boundaries for a child to be safe and healthy. We are the parents, so help us keep our children safe at home. I'm telling you that that happened to me with Ben at the age of 15. He wanted to get emancipated, and as soon as he decided to leave home, even though he had a safe home, he wanted to smoke weed. And Choices for Youth went into the schools and said, "Hey, if you're having trouble with your parents, come on over with us. We'll take care of you." And of course, what's over at Choices? People doing
Mhm.
smoking drugs on the premises. This is a great free for all. Get my house paid. I can live in drug homes. I can hang out and party. But what they forgot to say was, you're going to end up couch surfing. You're going to end up with Hep C. You're going to end up with starvation. You're going that all they forgot all of that out in their presentation. And
Mhm.
you're going to witness murders. You're going to witness suicides, and you're going to end up dead within a short order. That's the prognosis for kids that are allowed to be emancipated, taken out of safe homes. It's different if that house is not safe, and kids need to go into care. But when kids have a safe home and they're
Mhm.
taken out of their home and they're given the ability at 16 years old, absolutely right, Facebook user, at 16, you can leave home and go out on the streets and do drugs and get the whole thing paid for by our government. Like that is criminal. And that is
It, it,
one of the reasons why Ben is dead today.
so sorry. So we've got another comment here from Stacy. It blows my mind that in 2024, growing up with shows like Intervention, award-winning show that shows the crisis in America with these drugs and why people treat it like it's new in Canada. It's not new, you know, as in new, but Canada and not the entire concept is new. What can happen to people in the United States? It doesn't matter where people are located. The drugs affect anybody, anywhere, the same way. Same drugs, different people, different location, same outcome, death. So yeah,
Yes.
100%, Stacey. We'll get back to the video. We're going to end. Go ahead.
Oh, and thank you guys for chiming in on this, because these are important conversations that our politicians, our leaders need to hear. They need to hear the people who should be making the decision for the future are two people: parents and loved ones with addicted loved ones, and those who've come through recovery who actually know the way through to make it through this mess. And it shouldn't be people who don't have experience with this. It should be people like you and I, Janet, who have lived with it, who have gone through the gamut, who know the loopholes in the system. People in addiction are going to take the easiest way out, the path of least resistance. Yeah,
That's
well, it's up to us to architect a path of least resistance that ends up in recovery. And
Yes.
anything less than that is a lack of leadership and creativity in our country. And our prime minister should be held to task for that.
He should. And anybody that is advocating for these programs to keep people on a safe supply and keep drugs in their life, they should be charged. They should be literally charged. I mean, maybe they're brainwashed and they think they're doing good in the beginning, but after a while, they must see what's going on and they must know their job is destroying people. They have to.
Yeah.
They can't be that stupid, because if they are, again, another reason for them not to be in that job. And that's, again, my opinion. So, and then Stacy came up with another comment: sick of assuming that people and teens are starting this because they have an awful home. It's not. It's being glorified in the schools. It's being glorified. And when they were putting pallet homes across from schools, they're wondering what's going on. Oh, those people look so happy. They look like they're having a great time. I want to be these people. Are you kidding me? The last thing these kids should be seeing in a school is a bunch of people using drugs. Good God, who makes these decisions?
Exactly. And right now we have a culture of like doing drugs as the most acceptable thing. You can go
Yeah.
to work stoned, you can go to work stoned, you can go to school stoned, you can go to university stoned, you can be getting stoned on the street, you can be injecting on the street. And all this tolerance says it's okay. So all our kids are getting all the signals that, yeah, this is okay. And what we're not doing is saying to our kids, yeah, you partake in this, and most likely you're going to have the next horrific 7 years that you couldn't even possibly imagine what Ben went through. He was living in a shelter, and one morning he woke up and there was a man hanging, poor soul, from the side of the building. And
Oh,
that, Ben, like, how do you come back from that? Ben witnessed someone being murdered right in front of him. These are the things that kids have to deal with when they go on the streets. And you know, he's highly, highly addicted. The drugs that we have out right now, the fentanyl and carfentanil is so addictive that once you go there, you're not coming back from there.
no.
And if you're lucky enough to take it and still make it, and then there's people like Ben who just take one, some cocaine with fentanyl in it, and he's goner. And that's happening to so many kids, even kids that aren't doing a lot of drugs. They just, it's even in the weed these days. So street drugs with fentanyl and other more addictive drugs to get people more addicted, all for the sake of money and greed.
It is 100% to do with money and greed. And if we don't stop this horrible cycle that we're in right now, it's not going to get better. Things do not get better because we wish to get better. They're going to get better because we address the issues, seen a problem, and made changes to them. And that is the only thing that's going to work, is changing the way we do it now. We have to stop these safe injection sites. We have to stop the harm reduction people, because harm reduction is harm production in the long run. So we're going to run our shows for 45 minutes. we're going to be having a series of these guys because this is a 3-hour parliamentary thing. There's a lot of information in here. It's going to be doctors speaking. The Department of Health is put onto task and ask questions that are going to make her very uncomfortable. And we want you to follow along with this opioid experiment that the government is referring to here. It's a lot of good information. So we'll get to our next talking point, and we'll wrap it up after there. And again, great comments and great engagement for tonight's show.
Before I close, I want to mention that on October 30th, 2023, the Minister of Mental Health and Addictions and Associate Minister of Health launched a renewed Canadian Drugs and Substances Strategy. This strategy presents a compassionate, equitable, collaborative, and comprehensive federal approach to this crisis and may be of interest for you to study. In conclusion, it is essential to understand that federal actions alone will not end the overdose crisis. We stand committed to ongoing collaboration with provinces and territories, Indigenous communities, families, and people with lived or living experience.
So I think
You know
we'll
what?
close.
Yeah, I just want to say one last thing. I
Yeah.
sit here and I listen to that and I don't believe a word of it because I have
No.
I have pleaded with politicians. I have pleaded with doctors. I have pleaded with hospitals to help Ben. I have pleaded with so-called, shelters and places for youth and choices for youth. I have pleaded with all of those institutions and the judicial system. I pleaded with judges and for 7 years tried to save my son. And what goes on here in this forum makes me sick to my stomach because those people did not live through what I lived through with Ben, or they would not have the audacity to sit there and say that we're fixing this thing. We are so far from fixing this thing that we can expect just a huge number of more deaths, like in Newfoundland, almost doubling in a year. That is insane what we're doing to our children. Insane.
It is. And I know that they have the right, the right things in mind when they're wanting to get homeless off the street and put them in the pallet homes. But where they have gone wrong is allowing them to get high and to drink in there. So in my mind, I'm just waiting to see how many people are found OD'd inside of the pallet homes because it's going to happen. It doesn't matter where they're at. It doesn't matter. They're going to get high and these drugs are going to kill them, whether they're in or out of a home. It's the drugs that are the problem. It's enabling is the problem. Enabling is the cancer and rehab is the answer. That's the only thing that's going to, work. And until we get everybody on the same page. Now, another thing in this video that caught my attention is the federal government has got their own approach. They're not working with the provincial government and they're not working with the municipal governments. And if they don't have an organized approach to this in all 3 levels of government, how do they think it's going to fix itself? They need to work together. This is a unanimous problem that's facing the entire country the same.
Yeah, exactly. And Stacy says, I'm so sick of assuming that teens are starting this because they have an awful home. Parenting, addiction is not a parenting error. And then she says, I can tell you as a teen, I dabbled and was definitely a bit addicted to ecstasy. I stopped because something clicked and I just was done. But there ain't no fucking way I would try anything nowadays because that shit is laced with whatever they want. And that is true. Guys, kids out there, listen right now. These drugs, the weed pens, the pills that look like they're, one thing and they're another thing, they're laced with fentanyl to get you more addicted. So beware because people are dying all around us. And I don't know any kids right now that don't know someone in their close friend circle that hasn't died from drugs overdose.
It's true. I can think of several. So yeah, so Facebook user, this is Nancy Cleveland up in Halifax. I think dealing should be a federal crime no matter how much they get caught with, because if you're dealing, you are literally out making money off of somebody else's misery. You're potentially killing someone.
And this whole phrase, accidental overdose, that's got to be changed. The language, what it needs to say is overdose murders, not accident. There's no accident. When people physically take fentanyl, put it in cocaine for the purpose of making more money and making people more stoned, and it kills someone else, that is manslaughter. That's not an accident. Whoever decided to call that accidental overdose, that's manipulative, it's wrong, and that should be illegal.
Yeah. And Stacy says people aren't dying because they are doing the same stuff. They are dying because the shit they used and have been used to changes. And it's true. And this is a big comment here come from Nancy. So when my daughter went to Naomi Center, she got cut. She got cut off all her assistance and her drug program. She was on the methadone program. This meant she had to pay $10 a day for her methadone. She had no income. How was she supposed to pay for it? Apparently, you have to stay there for a certain amount of time before another health program kicks in. No women stay there because they know that they will be cut off from their assistance. We tried to help her pay for her methadone, but eventually she found, and the comment cuts off. So all I can say to that is that's terrifying. To be able to, have to go through that as a family, and you're trying to get help for your daughter, and then you see that you come to a block in the road where the help has just been cut off and now you're on your own. Again, they shouldn't be able to just drop you like a hot potato, because that is not health care, it's death care.
Yeah. So the answer here, folks, is speak up, speak out, tell the truth about what's coming, what's happening in your life. Addiction thrives in the dark. Take it out of the dark into the light by speaking up. Going to Guardians of Recovery is designed specifically to get the word out, make sure people know what's actually going on, the truth. The 3 calls I get a day from parents, you guys speak up, say what needs to be said, get it out there, and whatever we have to do, protest, lobby, share information, educate, tell the truth. I know you don't want to tell the truth because it's so difficult to express that, but we are now at a crisis level that is killing more and more kids, and failure to speak up will mean more people die. So it's up to every one of us. We are the government. We are responsible for the future. We're responsible for speaking out. So speak up and speak out.
Be a guardian of recovery. On that note, guys, we're going to end the show. Thank you for sharing and bringing awareness. You need to, in order to bring awareness, we have to have lots of sharing going on. All right. We're going to end the show tonight. Thanks again for tuning in, all your comments, and we will be back on Thursday to do it again.